We are looking forward to take you through some of the solutions and experiences of several of our plans that have volunteered to speak with you today and share some of their high priority elements with you as well. To get things started, wanted to let you know that we do have several things set up for you today. We do hope that should you have any technical issues, we have a team of technical support staff on hand, ready and available to support your needs. We encourage you to actually submit an email request to the CTO tech support at cms.hhs.gov email box. The other email address that we'd like to bring up for you is all of the questions that you have pertaining to any of the sessions that we go through today. We encourage you to sort of provide those questions to us in an email, and we do have an email actually set up dedicated just for those questions as well. We also ask that upon your submission of those questions that you also just identify the speaker so that we can immediately route those questions to the speaker for an appropriate response. The email address that we do encourage you to leverage is that of the BP webinar help at optimalsolutions.com. So here again, we do have several of these informations, and we'll sort of repeat those throughout the day for you. I'd like to, at this point in time, go ahead and bring up our very first speaker. We have with us today Dr. Kelman, who is Chief Medical Officer here at the Centers for Medicare and Medicaid Services within the Center for Medicare. He's going to actually kick things off for us and share with us just what the importance is of all of what we're here today to actually attend and see. So without further ado, please welcome Dr. Kelman.
Thank you all. Good morning and welcome to our 2013 Star Ratings Best Practice webinar. My name is Dr. Jeff Kelman. I'm the Chief Medical Officer for Center for Medicare. This is our first Best Practices meeting, and it's broadcast by webinar only. I want to thank everyone first for their hard work in preparation for this event, especially the presenters from our health and drug plans. Our star rating program rewards those plans with higher quality scores. If you are a 5-star Medicare Advantage or prescription drug plan, you receive a special election period, allowing you to continuously market and enroll beneficiaries throughout the year. CMS is very committed to improving the quality of care provided to our Medicare beneficiaries, and we want plans to continuously improve their star ratings. We hope eventually every plan will be a 5-star plan. We'll continue to encourage more beneficiaries to enroll in high-quality plans, and we're happy to see the numbers of 4- and 5-star MA and prescription drug plans grow in 2013 compared to the past. As mentioned at our spring conference, we're always looking for additional levers to encourage excellent performance. We see today's webinar as our first step by facilitating information sharing and collaboration between plans. Quality is not a competition, but a shared goal. Our presenters today represent just a sample of the high performers in our Part C and Part D program. They graciously have accepted our invitation to share some of their unique activities with other sponsors, which is key to improvement. While you're listening and watching today, we anticipate these ideas will catch your attention and start to generate conversations within your own organization. We have seen that high-quality plans do not just focus on individual measures and performance. They have a culture of quality and an overarching commitment to quality that's demonstrated in the way they do business. And that's key. This isn't teaching to the test. The speakers you're about to hear bring a broad set of experiences that will be interesting to anyone involved with the Star Ratings program. To give my own context in this area, I'd like to quote Sir William Osler, who said, "Every patient's care should be based on his and her unique circumstance. The good doctor treats the disease, the great doctor treats the patient with the disease." What he was really speaking about was coordination of care. To summarize the entire quality world, high-quality metrics do not produce good care coordination, but good care coordination produces high-quality scores. The basic elements include health assessment, definition of disease burden and complexity, initiation of care management, outreach, reassessments, and feedback. We expect you to learn about all these best practices in the elements today during the webinar. Thank you for joining us and enjoy the webcast. and enjoy the webcast. I'd like to now introduce Cynthia Tudor, the Director of the Drug Plan Health and Quality, the Medicare Drug Plan Benefit Group and Quality Group. Cynthia?
Thanks, Jeff. I'm so glad to be here today. I'm fresh from vacation, so hopefully I can be spirited about this. So let's try it. No. The slides need to come up, please. Changes have been made to the star rating systems to provide higher quality in addition to higher performance in our measures. Incentives have also been put in place for both marketing and payment purposes. Star ratings were created to allow comparisons of plans based on performance along with cost and coverage. Today, we also provide additional marketing and enrollment incentives for high-performing plans. In late 2012, we reached out to enrollees in low-performing ICON contracts to consider changing to higher-rated plans. We also looked to identify ways to leverage our star ratings to improve the position of highly rated plans and discourage enrollment by our beneficiaries in low-performing plans. Star ratings data are also incorporated into past performance reviews for new application requests or service area expansions. In 2015, we will begin to exercise our authority to terminate contracts with low-performing ICON plans, and these plans have already been warned of potential termination. What we found is that nonprofit organizations tend to receive higher ratings than for-profit organizations. In 2013, 55% of nonprofit contracts of MAPDs and 64% of PDP contracts received 4 or more stars. In terms of for-profit contracts, 20% of the MAPD contracts and 21% of standalone PDP contracts received 4 or more stars. We've also seen that contracts with more experience in the Medicare program tend to perform at higher levels. In 2013, nearly half of the Medicare Advantage prescription drug plans with more than 10 years of program experience received 4 or more stars. In comparison, only 18% of MAPDs with only 5 to 10 years of experience received 4 or more stars. For PDPs, we see that a large percent of contracts with less than 5 years in the program could not be rated in enough measures to receive a Part D summary score. However, for PDP contracts with 5 to 10 years in the program, we see that 36% received at least 4 stars. So we see this direct relationship between how long you've been in the program and your ability to perform. We've seen out in the marketplace a number of external groups that are providing all kinds of conferences about helping you improve your star ratings and your performance. None of us has gone to these programs, so we can't comment on whether they're valuable, on point, or correct. Instead, we thought it would be helpful to hold our own meeting, sponsored by CMS and without charging anyone. We started work on this event about a year ago as a pilot. We knew that our analyses of the last 5 years of star ratings would find many great examples of data of sponsors making innovative changes to improve their quality of care. We had to select only a sample of plans to interview and then invite them to today's webinar, and they've been most gracious in their willingness to provide this information. We hope today is the beginning of more collaborations with the industry and CMS about what it takes to achieve high quality. Best practices are not surprises. That's sort of the key here. We've heard a lot of key messages from a lot of the people that we've interviewed. Senior leadership buy-in is a must. There can't be silos within an organization. It has to look, not only do you need to coordinate patient care, you need to coordinate among your organization. Teamwork inspires everyone to work harder. Creating more reports is not the answer. Everyone emphasized that the data must be actionable. Creativity is also important. And last, of course, all of us have to continue keeping our beneficiaries at the center of our work. Today's areas of focus is that we'll be covering a lot of different areas that touch on operations, beneficiary care, providers, and quality. We have a very packed agenda. We hope at the end you will take away some useful information that you could apply to your own plan. We would love to see that this sparks more collaboration within the industry, plans helping plans. And last but not least, we hope the contracts that are performing poorly in our star ratings are able to glean from our speakers some specific steps they can take to improve. Thank you and have a great conference.
Well, that was a great intro for today's morning. Again, Dr. Kelman and Dr. Tudor also did share some great insights with us. What we'd like to do at this point in time is actually proceed with our plan and move on to the next session. We have two plans that are here today to join us and share with us again some of their insights around the innovative ways in which they have been pursuing the best ratings efforts. First up, we have for creating a culture of quality in your organization. We have Capital Advantage Insurance Company. Several representatives from that organization will be present here, and they're going to share with you some of those insights there as well. We also will be followed by Medco Containment Life Insurance Company, and again, the speakers there will be here to join us as well. So, without any further ado, let's go ahead and get Capital Advantage Insurance Company up and have them share with you what those elements are. So to kick things off, we'll have Gregory Park, Director of Medicare and Policy and Regulation Management at Capital Advantage. That's going to speak with us first to share some of his insights as well. So Greg?
Hi, everybody. Well, thank you so much for having us here today. We feel so privileged and pleased to be able to speak about our culture of quality at Capital Blue Cross. As you can guess, creating a culture of quality is a journey with a constantly changing landscape. And so we always have to be on the lookout for what's happening in terms of disease management, in terms of identifying ways that we can improve the health of our populations. Let me first tell you a little bit about Capital Blue Cross, our company. Capital Blue Cross has a membership of about 1 million, located in a 21-county service area in central Pennsylvania. We have a broad network of professional providers, about 11,000, and we have 37 hospitals within our network as well. We have two Medicare Advantage products, a Senior Blue HMO and Senior Blue PPO product, with a total membership of about 30,000, slightly more PPO members than HMO members. We also refer to this as our triple aim population, which will become a little clearer in the next few slides as we move forward. Now, our two populations in our Senior Blue products are slightly different demographically. Our HMO product is a bit older, with a greater burden of chronic illness in that population. And our PPO population is a bit younger, with a greater emphasis on health and wellness, and in staying healthy in older age. Well, let me tell you a little bit about our corporate focus on maintaining a culture of quality. It all begins with mission and vision, actually. And Capital Blue Cross retains a corporate focus on delivering medical value as well as being a healthcare leader in our community and the communities in which we serve. This is reflected in our corporate priorities that are defined for everyone consistently throughout our entire company. It's reinforced at every level of our organization, beginning with the board, through our senior leadership, and then to our overall staff. And now to pass the baton on regarding a solid quality foundation, I'm going to introduce you to Therese Narzical, who is our Senior Director of Quality at Capital Blue Cross.
We have a slide presentation too that should be popping up any moment. Well, while the slide presentation is popping up, I'll start and just continue on with what Dr. Chambers was talking about. This one. Creating a culture of quality really requires a solid quality foundation. We can advance the slide to slide 4. This gives you the corporate overview that Dr. Chambers spoke of. And the next slide. And here's the mission and the vision. The next slide, please. Okay. So creating a culture of quality, the Institute for Healthcare Improvement provides a framework that's aligned and integrated with our corporate mission and vision. This triple aim framework provides structural support with which to organize and focus the work, the projects, the people, the processes, essentially all on improving member health, improving experience of care, and getting the greatest value for what we spend and giving the members the best value for what they spend. Creating a culture of quality and the essence of quality itself is ever emerging. It's a property of the, or an output of the whole system working together. Quality does not come from the sum of the actions of the parts. It comes from a product of the interactions and interdependencies within the system. Because quality is ever emerging, we have the continuous ability to influence it, which gives us some essence. We may not be able to control it, but we can constantly and continuously influence it. Creating a solid foundation with improvement science and continuous improvement and/or learning at its core, we are working to leverage that influence in meaningful ways through the application and the integration of the triple aim framework. So the next slide. The IHI triple aim concept was pioneered by the Institute for Healthcare Improvement, and they really describe an approach to optimizing health system performance with 3 critical objectives that you see in the 3 corners of the slide. Participation in the IHI triple aim improvement community supports and guides shared learning with many different organizations, nationally and internationally. It's been an exciting collaborative. This enables a shared vision and enhances a shared understanding, and it allows capital to build our capacity to make improvements. The exposure to national perspectives and the experienced IHI faculty has allowed capital to expand focused work on improved member experience, really going beyond satisfaction and incorporating the 6 Institute of Medicine dimensions of safe, effective, patient-centered, timely, efficient, and equitable care. The exposure has also helped us to refine our approach to better health of populations within our membership, using the assets that we have to address the needs while identifying opportunities to eliminate waste or unnecessary redundancies. Essentially, we're working together collectively to proactively influence and improve the health of our members while pursuing the best value for what is spent. From an organizational performance management, learning, and growth perspective, one of the quality department's performance goals that's cascaded throughout the entire department is to integrate the IHI Triple Aim framework as a key initiative in all of the work that we do at Capital. Improvement is the focus of the quality department, and it's being extended throughout the organization. Our strategy is aimed to drive improvement internally in developing and redesigning quality programs, using benchmarks and balancing measures to focus on the opportunities and cost drivers. Externally, in how we interact with providers, partners, members, and vendors, engaging them as possible in evaluation, early intervention, and improvement. So one of the things we've done is to align and integrate our approach with national efforts. The Institute for Healthcare Improvement, the Triple Aim, which I've spoken of, the Institute of Medicine, the Quality Aims, and the National Quality Strategy. We also are differentiating for regional and local contexts because they have to be considered when you consider quality. All the while, we target the continued exploration and creation of quality and the delivery of medical value. Using Capital's mission, vision, and strategic intent to set the direction, we work across the organization to make the status quo uncomfortable and make the future attractive. Building and establishing a foundational infrastructure that allows the company to learn and lead forward. This foundational infrastructure helps deploy improvement methodology and also build improvement capability. It addresses the role of governance by aligning and integrating the senior team, and it helps us to reframe or confirm operating values to build the internal, external, and collaborative relationships and develop future leaders. This infrastructure is also instrumental in building the will to change, and that's a phrase from the IHI Collaborative. This will to change needs to come from within, as well as from the senior team and from grassroots efforts. This infrastructure is really key to beginning to deploy a systematic approach to improvement. So what we've done so far: learning and participation in the Triple Aim Collaborative helps to generate ideas and fuels other internal and external interactions that continue this idea generation. The continuous, the continuous generation of ideas that comes from listening to customers, providers, and comes through benchmarking and analysis of results, trending and segmentation of the population, while always understanding the organization as a whole system. Using a systems perspective informs the direction and development of our strategy. The foundational infrastructure for improvement that we've really created facilitates a dynamic process of design and redesign, the development and the deployment of ideas, the review, evaluation, and implementation of key initiatives. The CMS Quality Improvement Project and the CMS Chronic Care Improvement Projects are two of our key initiatives. The communication of results and creation of feedback loops to address the areas of opportunity and to appreciate the system advantages and successful implementation. So this multidimensional approach of the Triple Aim is enabling us to leverage and thoughtfully utilize our resources as well. It prepares us to address the increasing number of older adults needing higher levels of medical care. The journey is an adventure. So on the adventure, one of the main components and tools for this adventure is the PDSA cycle. I had to try to make it seem exciting. And it actually is, but when I got to this slide, I felt like I needed to tie it into something. So it's an adventure, and this is one of our main tools that we're utilizing and constantly talking about with our teams. Addressing the ever-changing landscape of healthcare is dependent upon cycles of learning and adaptive leadership styles. Using the model for improvement developed by the Associates in Process Improvement, and it's on the IHI website, we work to create a shared vision and an understanding of what we're trying to accomplish on the macro as well as the micro level. And it's a question we ask regularly as we're going through all of the different things that we're trying to accomplish. We try to focus in on what it actually is. This model really enables the team to develop, test, and implement changes leading to improvement and or learn from missteps, but doing so in a way that minimizes risks and uses measurement for learning and process improvement. Creating a learning organization based on continuous improvement is key to a quality culture. Okay, so this is a slide that I'm sharing from the IHI Triple Aim Learning Collaborative, and it demonstrates some examples of measures for each of the different dimensions. You can see population health, experience of care, and per capita cost. Creating this quality comes through the measurement of the three dimensions of the triple aim. These three dimensions are closely correlated with the manifestation of healthcare quality and medical value. These triple aim dimensions can be aligned and integrated with the Medicare Advantage Plan STAR measure domains as well. An example of how we're using measurement in the quality improvement project for CMS to reduce plan all-cause readmissions. In addition to plan all-cause readmissions, we're also measuring acute admissions per 1,000, readmissions per 1,000, skilled nursing visits per 1,000, and ER visits per 1,000. Looking at different measures helps you to understand the manifestation and the impact on other areas as well. It's one of our key learnings from the collaborative with the IHI Triple Aim. Because readmissions are in fact a subset of all acute admissions, and therefore looking at all acute admissions as well as those that result in a readmission is helping to shape and inform the context of how we work with providers and or members to learn and improve, particularly for segments of the population. So this is just really an example for everybody. It's an example of how projects are lined up. Again, it comes from the IHI and Compliments of Care Oregon, one of the members of the collaborative. So you can see how the projects are lined up with project measures, and they're connected to one or more of the triple aim dimensions. So we've identified population measures. We also have projects and project measures for each of the domains. The project measures consist of some of the population measures and then some specific project focus measures as well. Ongoing measurement for learning and improvement allows us to know whether changes that we make result in improvement and evaluate the ever-emerging property quality. At Capital, the people, processes, and teams use communication, collaboration, and continuous design and redesign to create a culture of quality. George Park will talk about some of the teams that create and maintain the culture.
Thank you, Therese. Good morning, everyone. I wanted to go back, as Dr. Chambers has noted earlier in the presentation, our Medicare Advantage population is rather small in comparison to our commercial book of business, but in that in no way diminishes the approach or the amount of attention that's generated around our Medicare products. We have a lot of support that comes around those products, begins with our executive team and works down from there. With that in mind, you'll see that we try to really build around a culture of quality, and it's all focused around teams and team support for developing that culture of quality. Back in 2011, we, through the support of our senior team and in full concert with them, developed what we call our STAR team. That is a team that is dedicated to look at HEDIS, HOS, CAPS, and all the various STAR measures. It's a cross-representational team that's made up of all the various departments that support capital. We have representation from our quality unit. We have representation from compliance, our Medicare programs unit, clinical, all the various departments that support. And the entire focus is really looking at our STAR measures and really trying to figure out exactly how we can better affect or better demonstrate with our beneficiaries and have a positive impact in their overall STAR measures. Additionally, we have our Medicare product team that my unit oversees. Focus with the product team is really taking that cross-departmental approach and really looking at all the various initiatives that are going on in the organization, as well as looking at industry information, looking at HPMS memo notifications, and really, again, just trying to create a communication vehicle inside the organization. In line with that, we also have our CAS team. Our CAS team, or our Care and Service team, is really focused around looking at complaints and grievances, customer service metrics, utilization management metrics, and also looking at clinical program performance results, access to care, various updates as far as regulatory processes, privacy, benefits. Again, with the primary focus around our Medicare population and really looking at how we can better affect our Medicare populations. We also established our Medicare CORB benefit team. This is a team that really is focused around looking at how we apply our benefits and making sure that when we're looking at our benefits that we're taking beneficiaries' best interest at heart. We're also looking at how we're configured in our systems. Again, with the primary focus of making sure that it's a seamless transition and best management to our beneficiaries. But I think what really sits as the underpinning for all these is the establishment of our PMO, our Project Management Office, because what we do is we use that Project Management Office as an opportunity or as a foundational point for all of our teams. So as we start to look at projects and project implementations, we start to look at new products and product offerings, we coordinate that through our PMO office with the understanding that they can really serve as a key driver to help us drive towards success as we implement against these products and processes. And I think that when you look at this slide as a whole and you look at where they're all focused around culture of quality and driving towards quality. So I think what each of these teams is bringing is a true dedicated focus aimed at comprehensive support and delivery of quality to our Medicare beneficiaries on a day-to-day basis, and it really reaches across the entire organization. So we're very grateful for the fact that we have such a high level of support internally that actually begins with our management team and with Dr. Chambers and the other executive members and drives from there. Next slide, please. This slide really talks about creating a framework and looking at how you can use capabilities to make improvements. And what we're looking at here is that really establishing an overarching framework so that we can drive medical value, and that's through tools such as clinical warehouse, analytics and reporting, clinical cost of care, and again, creating a framework for future collaborative projects. And what we're looking at is really bridging the individuals with the tools and resources that they need to be able to define improvements and define success. And the interface is needed because we need to really differentiate ourselves with our business and with our business partners to achieve what we consider to be an appropriate balance and synergy between the differentiation and segmentation with our Medicare populations. We continue to have ongoing collaboration with our provider networks, which would be inclusive of our ACA, our Accountable Care Arrangement partners, and also our employer groups, because we really, at the end of the day, want to make sure that we're impacting the overall health of our Senior Blue members, and that we're also creating opportunities to find the most innovative approaches in addressing the overall health of our members. We continue to deploy improvement methodology in pursuit of triple aim, as Teresa had mentioned earlier, and that's really a cross-departmental approach so that we can really reach across the entire organization and educate everyone in the organization around triple aim and around the IHI methods. And we have what we've done is we've looked at developing specific aims for our populations, our segments, and our subgroups, and using measures to really drive at what those aims should be, and really using the tools and the resources available to us to try to make the most beneficial decisions for our populations. So again, I think the overall message being conveyed through this slide is that we're using knowledge of improvements to build a learning system. So, Dr. Singh? You want to wrap us up?
Well, hopefully we've been able to share with you really our cultural commitment, senior leadership commitment, and framework and strategy around how we maintain a culture of quality. As I mentioned earlier, it's a journey. It's not the destination that really matters, because the destination is going to constantly be changing. So we're happy to entertain questions. Okay. So we'll hold off on questions right now, and that concludes our presentation. Thank you.
Good morning. I think I'm next up on the agenda here. Good morning, everyone. My name is Becky Rabbit, and I wanted to start by thanking CMS for inviting us to come participate in this seminar. We're really excited to be able to share some of the ideas, some of our practices that we have at Express Scripts. My responsibility at Express Scripts is I'm Vice President in our Government Programs Division, and I have responsibility for Medicare and Medicaid. With me is my colleague, Kelly Turner. She's a director in our Government Programs Division, and she's responsible for a lot of our clinical initiatives. So what I hope to share with you today is how compliance really drives our strategy at Express Scripts, how we really infuse it into our member experience, how compliance helps us to drive and support meaningful clinical outcomes, and how this whole process leads us to continual operational assessment. As we all know, it's a challenge to, this is a complex program. It challenges us every day. And so we're really focused on how we can learn every day from a lot of the issues we struggle and we are challenged with, but we use that and for constant improvement. Just to give you a little bit of background, Express Scripts has participated in the Medicare Part D program since 2006, and prior to that with the Medicare Drug Discount Card program. Today we're supporting over 2.1 million members in our prescription drug plan. We serve individuals as well as groups. If we can go to our next slide, please. I think you will hear some themes today. A lot of the themes that I'm going to be talking about, we've also heard from our colleagues with Capital Advantage. Our member experience is really key. I think this afternoon we're going to talk a little bit about member experiences, recruitment, retention, and how we satisfy our members. And it's really what drives a lot of the initiatives that we have at Express Scripts. We collaborate really closely with our PBM to ensure we're continually looking across the healthcare continuum, because our goal is to improve our existing programs as well as introduce new programs that help us close the gaps in care. We try to ingrain quality in everything that we do. We have a number of initiatives and programs in place to closely monitor areas such as our grievances, coverage determinations, our clinical programs, because we want to ensure we have the right level of controls and tracking in place. Our commitment to quality ensures we not only operate in compliance with CMS requirements, but that we also continue to deliver quality services to our members. So now I want to ask Kelly to describe how our quality process is applied in our clinical programs.
Thank you, Becky. And shortly, Becky will be discussing how some of our non-clinical initiatives, but as she indicated, I'll start by discussing some of our clinical initiatives and our best practices there.
Express Scripts really does look across the healthcare continuum when managing our quality initiatives and compliance for the Express Scripts PDP. Part of the success is that within Express Scripts, all areas work in lockstep with the PBM to focus on quality through education, safety, and closing gaps in care. Of course, everyone can say that they focus on quality, but really without a solid plan, agreement on goals, and then subsequent monitoring to ensure those goals are being met, it really is difficult to maintain that quality in the long term. I'm going to walk through this cycle that you see displayed on the screen. Of note, it really is intended to be an ongoing process. There really is no beginning and end to our quality process, but for sake of our discussion, I'm going to start in the top right-hand corner. And in our case, the leadership team identified and defined quality objectives and compliance-related metrics. Some of these objectives included a focus on educating members through clear and concise communications, creating a focus on initiatives that address safety, as well as intervening to close gaps in care, all of which contribute to positive health outcomes for our members. And ultimately, these objectives were being met through programs utilized through our PBM, customer service training, and overall quality monitoring. The next step in the process is truly establishing relevant and meaningful measurable metrics for each quality initiative. On a regular basis, the metric performance is then reported out to our leadership team. And what we found here in this process, and Becky will discuss it in more detail shortly, is that by reporting out in one central venue the performance, it first of all provides leadership a really good feel for the overall performance of the plan and of the organization. More importantly, it allows other team members to hear and be exposed to the performance in other areas of the company. And ultimately, most importantly, it drives accountability for these teams and really instills a sense of ownership in these metrics. And it really allows people to take that ownership and really work through those processes with passion. You can go on to the next slide. And I'm going to describe how we've applied this process to our medication therapy management program. And within MTM, there really can be a number of different metrics that could be monitored. And when developing the metrics, it really was critical to look at what was most important to overall program success. Some overall goals of our program include ensuring members receive quality care through comprehensive counseling, as well as the ability to quantify the quality of care through measuring clinical outcomes. Ongoing evaluation and monitoring is, of course, critical to see if a metric needs to be added or enhanced in any way, as this business truly is continually evolving. Once those metrics were defined, they were then communicated to cross-functional teams, as we felt that was critical to secure agreement to the end result. As an example, we determined that we needed to complete more comprehensive medication reviews. We first started by taking a look at our existing capabilities to see what could be enhanced to achieve this goal. We first took a look at our targeting in terms of how we were targeting members for inclusion in the MTM program. What we identified there is that we felt that we were actually targeting a really broad population of Medicare beneficiaries by targeting a lot of the very common disease states in the Medicare space, and so we felt that this was achieving our goal by ensuring that we're reaching as many members as possible and providing that quality care. Our next step was taking a look at our Agile platform that we had built to see if it was truly operating at an optimal performance. Through this process, we actually identified that we had an opportunity for some incremental improvements that could be made to the platform to allow the MTM staff to complete their documentation in a much more efficient manner while still being able to interact with the patient. Ultimately, the staff was able to complete even more comprehensive medication reviews in a shorter amount of time. In addition, we also identified an opportunity to provide specialized training to the MTM staff. We felt this would also help increase the number of reviews that could be completed, but more importantly, it improved the quality of the interaction that the MTM staff had with the beneficiaries, leading to improved healthcare outcomes. Though these steps seem small, overall they actually did lead to improved metrics based upon the overall goals of the program when combined all together. can go on to the next slide. And after sharing how these quality practices really related to our MTM program, I wanted to provide an example of how that quality oversight can translate into specific positive outcomes for our patients. In this scenario, one of our specialist pharmacists had identified through the patient profile that this particular member was suffering from kidney failure while they were using a drug used to treat seizures, particularly Keppra. This particular medication can accumulate in the body when the patient suffers from kidney failure, potentially leading to a number of serious adverse effects. The pharmacist was able to discuss these potential effects with the member, and then also contacted the prescriber to discuss dosing in the light of the member's kidney failure. Ultimately, the prescriber ended up decreasing the dose of the seizure medication, as well as planned to follow up with the patient's specialist physician. Interventions such as this really are critical in providing quality care to our members. Not only can they provide a positive outcome, but more importantly, they may even prevent a negative outcome from occurring. And really, we just wanted to highlight this example to show that the plan absolutely has the power to make a difference in the life of each individual member and truly can facilitate coordination between the patient and prescriber to drive improved outcomes. In addition to the example I had shared with the MTM program, there are a number of other programs that have generated positive health outcomes, ultimately leading to improved quality for our members. Again, it is important to have specific goals in mind when deciding what initiatives to focus on. You can choose to leverage the concept of existing programs, perhaps the retrospective drug utilization review initiative, by adapting, enhancing the program criteria into new initiatives to really provide interventions aimed at addressing these specific goals you are trying to achieve. Within this particular program, we can drive improved clinical outcomes by detecting important health and safety issues using patient-specific prescription data so we can alert key stakeholders, such as the physicians, the pharmacists, as well as the patients and their caregivers themselves, to affect changes in drug therapy based on evidence-based guidelines. We use this general process to intervene on a number of different clinical issues. So we might be able to identify utilization of high-risk medications to be able to intervene and suggest a more appropriate alternative for the member. We can also identify potential gaps in care, such as identifying the need for an ACE inhibitor or an ARB for patients who have diabetes and hypertension. There is even applicability outside the STARS program, specifically for the Medicare population by identifying instances of polypharmacy. These complex regimens really can lead to an increase of adverse events, injury, and perhaps even hospitalization. So these truly are critical opportunities to intervene and provide quality care. And so one last initiative that I wanted to talk about before turning it back over to Becky is the concept of personalized medication. We hear a lot today in the healthcare space about pharmacogenomics and tailoring drug therapy to a specific member. While those things are all important, we really think of personalized medication in a much broader sense, delivering healthcare to the patients based on who they are, not just based on what disease they may have. Clinical specialization provides disease-specific expertise to patients, where we have specialized clinical staff that are offering personalized care to our beneficiaries to give them the information and counseling that they need to be adherent to their therapies and achieve healthier outcomes. The clinical specialization capabilities are focused on many complex and chronic diseases, such as cardiovascular disease, HIV, diabetes, cancer, asthma, depression, and other rare specialty conditions. When a patient talks to one of our specialty clinical pharmacists about their gap in care, the pharmacist has access to a personalized, member-specific health action plan. And this health action plan truly defines the specific gaps in care as well as the potential severity for that particular member. The health action plan is a powerful and an actionable tool. It provides our pharmacists and benefit specialists with a full view into the patient's profile to help us close those gaps in care for our patients, whether we're performing clinical activities behind the scenes or whether we're interacting directly with the patient on the phone. In addition, members can also receive information on these safety issues and gaps in care through the member website when they access it. One of the benefits to this program is that it truly is able to intervene on a very large population of patients. That is slightly different than the MTM program, which focuses on a very targeted group of beneficiaries with multiple chronic disease states. So these two programs really work in concert with each other to ensure we're really targeting all beneficiaries as appropriate. And as we discussed, clinical initiatives are, of course, not the only way that we can improve outcomes for our members. So I'm going to turn it back over to Becky, who will discuss some of our non-clinical initiatives.
Great, thank you, Kelly. Quality outcomes must measure and focus on the right things. So it's really important for us to think about on a regular basis and re-review what are those right things that we should be looking at. And it really, it is important for us to have a culture of compliance that is really supported from our leadership top down. And I know I have this when I hear our CEO unsolicited asking about member access, and has this created a member access issue, or what were the impacts to the members in our plan. And I know from other senior leaders throughout our company also are focused on the importance of serving our Medicare beneficiaries, and that really helps me as a person, as a leader in our government programs division, really support throughout our company the focus on a culture of compliance, and that we really do have our leadership support all the way from the top down. So to illustrate, let's go ahead and we'll move to our next slide.
I think one more slide.
This is the right slide, thank you. To illustrate, we've created at Express Scripts what we call our Compliance Oversigt Review Board, affectionately known inside our four walls as CORB. And we have gone on a campaign to make sure that outside of government programs, everybody understands the concept of our Compliance Oversigt Review Board. It's a cross-functional leadership team, and they review all of the initiatives and the programs within government programs. Really started with a Medicare focus, but now our government programs division is also encompassing Medicare, Medicaid, as well as healthcare reform. Some of these initiatives are also receiving the same level of compliance oversight. This review board was established a few years ago, and it was established to ensure that we had a process for assessing and reviewing all of the initiatives that support Medicare, Medicaid, and healthcare reform business. It also was there so that our individuals working on specific initiatives didn't have to make a lot of these very difficult decisions on their own, but that they had a forum whereby there was cross-functional leadership to debate, to discuss, and to help make a decision that got formalized in writing how we were going to address this particular requirement or issue. This board meets weekly. It provides a central forum for our teams to bring items forward that require regulatory and compliance review. So as you've struggled with various initiatives, you know there's not just one way to get something done. And it allows our teams the ability to bring forward a variety of ideas, and it also allows leadership to weigh in on those ideas. And sometimes through that discussion, we even get a better solution that we're going to move forward with. Some of the examples of things that come before our Compliance Oversigt Review Board include CMS directives that get released. We might have a review of a unique benefit design or a formulary question, or even a program enhancement. We also have issues that come through. Something may not be working the way we intended, or somebody brought something to our attention. And these issues will also come before our Oversight Review Board. We have a means for tracking and logging all of the items that come before the board, and we memorialize all our decisions in minutes that are distributed broadly throughout the company. I can't tell you the number of times this has been extremely helpful in determining what did we know at the time we made this decision. Because as you know, we learn as we implement the benefit. We also get guidance that further clarifies issues that were brought up or that weren't clear in original memos or guidance. And it helps us to go back and be able to reassess what did we know at the time we made this decision. Do we have more information now that we want to reconsider that decision? In addition to the review of new initiatives, the board will also monitor and re-review current programs. So on an ongoing basis, we have our program audit team come in and report how audits are going. We all have our program integrity come in and report on a regular basis what they're doing in our fraud, waste, and abuse areas. This board, as I mentioned, has been in place for several years, and it's proven to be very successful for ongoing monitoring and tracking for our own prescription drug plan. To the next slide, please. It's really important also that we embed this philosophy of compliance and quality throughout our organization. While our Government Programs Division is ultimately responsible for the Medicare offering for our prescription drug plan, we rely on a lot of partners throughout our organization. And so we have this concept that we call embedded compliance. And we have identified individuals throughout the organization that help us spread the message of compliance and the importance of quality measures in serving our Medicare beneficiaries. Every directive, every issue, every communication, every deliverable goes through this compliance process. And we expect that our individuals who are designated as embedded compliance personnel to live and breathe the same level of compliance that our government programs team also has. Now, we all know the importance of reviewing the CMS guidance on a regular basis and understanding how it may or may not impact our business. But what's even more important is for us to ensure that there's a continual review of our policies and procedures, and that all the critical requirements get documented along with the processes that we invoke to ensure they're being followed. So I'm going to talk about a couple of, give you a couple of examples of how we've built that into our ongoing organization. We have a policy committee which used to meet monthly, and now it is meeting weekly, and they review all of the policies and procedures that govern our government programs business. Primarily driven by Medicare, it's also now being driven by, we're starting to see work come into this committee for Medicaid and healthcare reform. And it's really critical that we ensure that our business processes and procedures are documented concisely with ongoing monitoring and tracking to ensure that, at a minimum, our policies are reviewed on an annual basis. When new guidance and directives come out, we also will then trigger that a particular policy and procedure must then also come before the policy committee, because we know this particular guidance has required a very important change. In addition, we also deploy annual training to all the individuals who work in Medicare. So not only is it our government programs team, which is responsible for staying up to date with all of the guidance, but we also extend that training to all of the embedded compliance personnel and their teams throughout our organization. And we document that all this training was completed, and the training includes testing as well as certain performance levels on the test. So we take it very seriously that our partners throughout the organization are also subject matter experts in their particular area. Sorry, slide 10, please. Thank you. How do we know that we're looking at the right things? In addition to identifying the metrics that need to be developed and tracked, there needs to be an established process for the documentation and monitoring of these various metrics. Kelly implied a little bit as to what we are calling our operations workbook. And so we've identified metrics that are really important for us to track because they drive our quality and our compliance initiatives throughout the company. And they're owned by individuals across the company, which was why it was so important for us to embed this philosophy of compliance throughout our organization. All these metrics are clearly identified, defined, and we're given a threshold that we agree upon as a group as what will constitute compliance and quality that we want to deliver. And on a monthly basis, we review all of those metrics, and we assign, based on that given measure, whether it is green, whether it's yellow, or whether it's red. And through this review process, leadership has visibility into how these metrics are actually measured. Anything that's yellow or red, of course, has to have, gets immediate attention by our leadership and has to have a path for obtaining it, moving it over to green status. The monthly review process is critical. It helps us to proactively identify issues that need immediate resolution. Not only do we look at where the metric is today, but we also look at where the metric has been in the past, because the trend is really important for us to look at. It helps us get ahead of things before they become significant problems. The operation workbook has also been in place for a number of years, and it ties directly back to our performance goals that are established for our government programs organization. Shown here is an example of what our tracking mechanism actually looks like. A level deeper than this is actually a tracking mechanism for all issues that get reported, whether they're compliance issues or simply just daily operational issues. And our compliance and legal team is plugged into that on a daily basis as we assess every new issue that gets reported to our government programs team. So you're probably asking yourself, what makes Express Scripts different and or unique from other organizations? And I think you've seen throughout the presentation that we have a critical focus on quality and compliance. Throughout our organization, we're really focused on our member experience. It's extremely important because if our members are not satisfied, if they're not having a good experience, it creates lots of quality problem. It's a quality indicator for us, and it also speaks directly to our ability to retain those members into our program. We also have a focus on our star ratings. We gave a few examples of some of the metrics and initiatives that are driving how we look at quality overall, but certainly our star metrics are also very important and a focus of a lot of the discussions in these various groups I made reference to. And lastly, we have a culture of compliance. Our compliance team is separate from our government programs team, but works very closely in making sure that all of our initiatives are aligned throughout the organization. So in closing, I just want to thank you for this opportunity to share some of our practices and welcome any questions that you might have.
Thank you very much, ladies and gentlemen. We did actually enjoy your conversation around that. At this time, everyone, we are going to actually go ahead and take a 30-minute break. We ask that you reconvene, and we will resume with the rest of the program. Thank you so much.